Welcome to Wellness Warrior Hacks. This video provides an overview of high blood pressure, also referred to as the silent killer. 6 signs that may reveal you have high blood pressure. High blood pressure, also medically known as hypertension, is often referred to as a silent killer, as it often has no warning signs or symptoms. What makes it particularly dangerous is its lack of evident symptoms in the early stages. It poses significant risks when left unattended, possibly leading to severe health complications like sexual dysfunction and aneurysms. Moreover, high blood pressure can be associated with kidney damage or vision impairment. Over time, high blood pressure may in fact lead to heart disease and stroke. It's a condition that affects millions worldwide. Fortunately, there may be certain signals that hint at the presence of high blood pressure. One prominent contributing factor to high blood pressure is high dietary sodium intake. Sodium plays a crucial role in maintaining fluid balance and nerve function in the body. However, excessive consumption of sodium, primarily in the form of salt, can lead to elevated blood pressure levels. Furthermore, sodium is an essential electrolyte that regulates the body's fluid balance. It helps maintain proper hydration, nerve function, and muscle contraction. When the body receives excess sodium, the balance of fluid within cells and in the bloodstream is disrupted. One indicator of high blood pressure is headaches. The relationship between headaches and hypertension isn't fully understood, but it's believed that in some cases, it's caused by increased pressure within the blood vessels. This increased pressure impacts the blood vessels in the brain, or causing changes in the brain's blood flow. Most headaches related to high blood pressure tend to be more severe and occur in the morning. These headaches might present as dull, throbbing sensations, predominantly felt at the back of the head or radiating to the temples. It's also crucial to recognize that headaches can have various causes, and while they can be a symptom of high blood pressure in some individuals, they're not always a definitive indicator. A second predominant sign of high blood pressure is vision problems. If you experience blurred vision or sudden visual disturbances, it can sometimes be linked to high blood pressure. Visual changes can be associated with high blood pressure because elevated blood pressure can affect the blood vessels in the eyes. High blood pressure can cause changes in the small blood vessels throughout the body, including those in the retina, the light-sensitive layer at the back of the eye. If the blood vessels are damaged, it could lead to hypertensive retinopathy. Hypertensive retinopathy can cause bleeding in the eye, blurred vision, or even vision loss if left untreated. A third sign of high blood pressure is breathing challenges. Breathing challenges, specifically shortness of breath, can sometimes be associated with high blood pressure due to its impact on the heart and lungs. When blood pressure is consistently high, it can strain the heart over time. The heart must work harder to pump blood against the increased resistance in the blood vessels. This increased workload can lead to heart-related issues such as heart failure. Over time, the heart's muscles can weaken due to the strain, leading to difficulties in effectively pumping blood. This can result in fluid buildup in the lungs, causing shortness of breath. Pulmonary edema is another issue you may develop due to high blood pressure. It can cause fluid to build up in the lungs, making it harder to breathe. Additionally, high blood pressure can be associated with other conditions like coronary artery disease or atherosclerosis. These conditions can further contribute to breathing difficulties by affecting the blood flow to the heart or narrowing the blood vessels supplying oxygen to the body. High blood pressure, if left uncontrolled, can lead to various cardiovascular issues, including an irregular heartbeat, medically termed as arrhythmia. Consistently elevated blood pressure forces the heart to work harder to pump blood throughout the body. This increased workload can lead to changes in the heart's structure and function over time. One common arrhythmia associated with high blood pressure is atrial fibrillation. The upper chambers of the heart, atria, beat irregularly or rapidly, affecting the heart's ability to pump blood efficiently. High blood pressure is often linked with other issues such as coronary artery disease, heart failure, and valve problems, all of which can contribute to irregular heartbeats. It's important to remember that high blood pressure is only one of the causes of heart-related issues. Fatigue and confusion can sometimes be associated with high blood pressure, particularly when hypertension reaches advanced stages or causes complications affecting different organs, including the brain. Persistent high blood pressure can damage blood vessels, including those in the brain. This may reduce blood flow to certain areas, affecting brain function and potentially causing confusion or difficulties in concentration. Severe hypertension can increase the risk of transient ischemic attacks, TIAs, or strokes. These events can lead to sudden confusion, weakness, trouble speaking, or temporary loss of consciousness. While not directly fatigue, the recovery from such events can cause fatigue as well. Sleep apnea, which is often associated with high blood pressure, can lead to poor quality sleep, causing fatigue and contributing to cognitive issues and confusion during the day. Fatigue and confusion are not exclusive to high blood pressure and can be indicative of various other health conditions or factors. Experiencing a cluster of symptoms such as headaches, visual changes, shortness of breath, irregular heartbeat, fatigue, or confusion can be concerning, especially if they seem to be linked to high blood pressure. Inform the healthcare provider about all the symptoms you've been experiencing, their severity, and any potential triggers or patterns you've noticed. The presence of blood in the urine, known as hematuria, could signal kidney complications due to high blood pressure. This manifestation might be visible to the naked eye, presenting as pink, red, or cola-colored urine, or it might only be detected under a microscope during a urine test. Blood in the urine might be painless and intermittent. It's imperative to seek medical evaluation to identify potential causes, including hypertension-related kidney issues. Effective management of high blood pressure often begins with simple yet powerful lifestyle changes. These modifications not only contribute to better heart health, but also pave the way toward a more balanced and fulfilling life. Consider making certain dietary changes, because what you eat affects your blood pressure. Avoid unhealthy oils like margarine, soy, corn, and processed olive oils. These healthier fats contain helpful nutrients that can aid in better liver health and assist in managing blood pressure. Start by checking food labels to identify and avoid unhealthy oils. When cooking at home, choose healthier oils for your recipes. Incorporate foods rich in healthy fats into your meals, like adding avocado to salads or using olive oil in dressings. Enzyme supplements can aid your liver in breaking down extra fat. They contain specific enzymes that support the liver's ability to process fats efficiently, contributing to healthier blood pressure levels. Consult your healthcare provider before starting any supplement regimen. If they recommend enzyme supplements, take them as directed, usually before meals, to assist in fat digestion. Cutting back on sugary and starchy foods can help manage blood pressure. Minimize your intake of sweets, bread, pasta, rice, and potatoes, and focus on eating foods that fight inflammation, like fish, grass-fed meats, and eggs. Gradually reduce sugary and starchy foods in your diet. Replace them with healthier options like whole grains, vegetables, and lean proteins. Experiment with new recipes that use these healthier ingredients. Supplements like milk thistle extract can aid your liver in healing and managing your blood pressure. They contain substances that boost antioxidants in your body, promoting liver cell repair and reducing inflammation. Intermittent fasting involves eating within a specific window and fasting for the rest of the day. This approach helps the liver recycle old tissues and proteins, promoting better liver function and potentially aiding blood pressure regulation. Begin slowly by extending the time between dinner and breakfast. Gradually increase fasting periods as your body adjusts. A morning mixture of apple cider vinegar and lemon juice and water provides acids and vitamin C that support liver cleansing, reduce fat buildup, and aid in digestion, potentially influencing blood pressure regulation. Mix 1 tablespoon of apple cider vinegar and 2 tablespoons of lemon juice in 500 milliliters of water and drink it on an empty stomach in the morning. Start with a smaller amount if the taste is strong and gradually increase it. Incorporating these lifestyle changes gradually into your routine can significantly impact your overall health and blood pressure management. Always consult with your healthcare provider before making significant dietary or supplement changes to ensure they align with your specific health needs and conditions. Taking small steps toward a healthier lifestyle can make a big difference in managing high blood pressure and promoting well-being. For additional insights on handling high blood pressure and other health-related concerns, consider showing support for this channel by liking this video and subscribing. Your ongoing encouragement means a lot. Wishing you all ongoing health. Wealth and happiness.